Welcome to the Prescription Strength Podcast. I'm your host, Dr. Lynette Hewitt, GP and personal trainer, bringing you health and strength without the hype. Thanks for listening. In this episode of the podcast, I'm talking to Dr. Claire Davies. Claire is a GP in Hackney, and she's also a coach working with female doctors to help them bridge the confidence and capability gap. We discuss the importance of being heard in the healthcare system and how both doctor and patient can work together to better navigate the healthcare system. It's a great conversation. I'm sure you'll enjoy it. Claire, thank you very much for joining me today. I appreciate you taking up my offer to have a conversation. And I'll just introduce a bit of background as to how this came around. It was two events colliding, really. Firstly, I was reading this book. It's called The Doctor as the Patient. Doctors recount their experiences on the other side of the consultation desk, which I was reading in a very leisurely fashion and having quite a profound amount of reflection on some of the things it made me think about, because I haven't been a patient for any significant length of time. And then at the same time that I was reading this, I put a post on Instagram when there was a story in the news about a young lady who'd been to the GP 3 times at least and not been heard. She went on to be diagnosed with cancer and sadly died, and she was only 27. And I felt very strongly about this because the response from the health secretary was to remind us as GPs that if we see somebody 3 times with the same symptoms, we should take it seriously. And my feeling was, hang on, I was taught that 20 years ago. As far as I'm aware, we're still teaching students and GP trainees that, but obviously somewhere the message is getting lost. And that was why I recorded a short reel on this topic. And it's safe to say it went berserk. It's almost become a forum now for people sharing stories in the comments section of that reel about their difficulties in being heard in a consultation, not just with GPs, but with specialists and across healthcare settings. And given that I saw the response to that post at the same time that I was reading this book, one of the things that struck me was it's not really any different when doctors are the patients themselves. And I reached out to you, having contributed to this book and been involved in it, and wondered if you would be willing to have a chat about your own experience, which is shared in the book. You've been on the other side of the consulting room desk, so to speak, and you are a doctor, GP like me, and you also work as a health coach, helping people who've, is it fair to say, lost confidence, and a lot of people have coaching at a crossroads in their life. And you kindly agreed to come on, which I'm very appreciative of. So with as much detail as you're happy to share, Claire, would you give us an overview perhaps of your experience having been a patient and what insights it gave you that perhaps we might assume we don't have as doctors?
Okay. So first of all, thanks very much for inviting me, Lynette. I'm really glad you found the book interesting and useful. For anyone that isn't aware of it, it is a collection of stories of doctors that have been patients and what it's like being on the other side, which certainly for many doctors, it's a very strange and educational experience as to what it is like being a patient, and often a very difficult one because so many dynamics change with that. And although the modern healthcare is trying to move towards a conversation of doctor-patient partnerships, there is still very much power dynamic that's present, and you are on the other side of that power dynamic. We know the system, very intimately. So we know what works, but we also know when things go wrong, like that tragic case that you mentioned, Lynette, which has been in the forefront of many of our minds. I think it was possibly 20 consults that young lady had, if it's the same one that we're thinking of. And as doctors, we don't like to ask for help. It feels very uncomfortable. And I'm aware the audience here are, likely majority not medical. So I think there are themes there that many of us share. We feel uncomfortable going to the doctor. It's vulnerable. It's exposing. We have to take our clothes off. All of those things. So there are a lot of parallels that I saw, and I think they're somewhat amplified for a doctor being on the other side as a patient. certainly I found it very challenging.
Yeah, I think a lot of the stories in the book brought that to mind, in that there was a number of things that stuck out. The rehearsing of what you might say on the other side of the consultation door, which is no different when you're a health professional to patients do it all of the time, not knowing what response you're going to get. The feeling that one of the things in the later stories in the book that came across was this feeling of not wanting to feel like you're wasting the health professional's time. And I think that for me, having not spent any significant time as a patient, that was really quite revelatory, because you would think that a doctor would know full well they've got every right to be there, but what you know logically and what you feel emotionally are worlds apart sometimes.
Actually, my experience of when I've consulted with healthcare professionals, when I'm the doctor, I find that they come in and the first thing they say is, I don't want to waste anyone's time. But many patients also say that they have read in the news about the pressure on the health service. They're seeing the strain the staff are under, and it is honestly often the most sick people that come in and say, I don't want to waste anyone's time, and then tell you something that actually you're absolutely not wasting my time. You really need to be here with this. I'm so glad you came.
Yeah, I think the phrase I've said many times and probably continue to say throughout my career is, I do get paid for being here, you know. If you don't come,
yes, I hear that, yeah.
If you don't come, I genuinely don't have a job to do. So please don't see it as wasting my time. This is what we do.
Yeah, exactly. But you also picked up on something there about, when we sit there and we're rehearsing what to say before we go in and wondering what it's going to be like. There's something there about trust, and that's something that we are really struggling with in the healthcare service at the moment, because we are losing continuity for so many reasons. And if you know you are going in with someone you already have a good relationship, you do not have to have that trust question over your head. Whereas if you're going in and it's going to be a new person every time, there's always this, who am I going to see with? I'm going to feel like I have a rapport with them. We can't form rapport with everybody. We're all different humans. We're just going to have people we get on better with the other. Will we feel heard? Can we trust them? Do they know about my problem? Because healthcare is becoming so complex, and there are, many doctors now really upskilling in menopause, for example, but there are many that it's not their topic. So, if you're going in about HRT, will they understand my topic, or should I have seen someone else in the practice? There are all these conversations and questions going on in your mind before you go into a consultation.
Yeah, I think one of the frequent comments on that post that became a forum was the remark, well, it's impossible to get an appointment. So that's the first hurdle, is the stress and the battleground that people are feeling, which doesn't benefit anybody. That is no fun to be on the other side of the consultation desk either. Having been around long enough to remember when you could quite feasibly see somebody on a Monday and follow them up on a Friday, knowing there would be space on the Friday. That's not the case now. To follow them up in the same week and feel safe, or just that check-in, you have to add them as an extra a lot of the time. I know different surgeries are organising themselves differently. So that is a frustration on both sides. It's a risk to continuity. We know that continuity improves outcomes, it saves money, it builds trust. There are really very few downsides to continuity, but it's getting harder and harder. And I think that came across very much in some of the doctor's stories as well, that dread of having to repeat the whole story from start to finish and not know how it's going to be received, especially when it's an ongoing condition as well. That feeling that somebody knows you and you can pick up where you left off, I imagine, is probably worth an awful lot, I would say.
It's harder work for everybody. I mean, what I try to do with that as a doctor is say, I've read your notes and this is what I understand and where we are at. So making sure you've read the notes, ask, is there anything else you would like me to add to that? And I think just to connect, patients will need to say, yes, this and this and this and this is what I'm here for. But you have to, work differently together to try and maintain that understanding and connection. I think continuity for me when I was a patient was something I tried to hold on to at all costs. Because I knew the benefit of it for me, because then you would have that trust piece going on as well, and you knew that they knew your history.
And I think one of the other difficult parts as well, which you will understand, and is we need to rely on specialist services, and we need to be able to refer in and out to secondary care. But often what that requires is people fitting into certain pathways. I don't know, perhaps in your part of the country what it's like, but certainly here where I work, our locality, everything has to fit into a certain pathway. So you end up having to almost divide the patient up into their relevant set of symptoms before you can get them into secondary care. And I don't think that helps either, because as we know, people are complicated. And if you've got certain chronic diseases, it overlaps different systems. People don't fit into nice, neat boxes, but in order to get access to secondary care, sometimes you have to pick one and choose. I mean, the common example would be the overlap of abdominal pain in women, and sometimes this tug of war that goes on between gynecology and general surgery or gastroenterology, and everybody's saying, well, we've done our bit, so that they bounce the patient around. And then if the person hasn't got continuity with a particular doctor either, a particular GP, either, then they really are a ping pong ball just bouncing around the machine.
Yeah, it's funny. We were just talking about a case last night in our clinical meeting of someone, with tummy pain, or do they go to gynecology or surgeons, and the tussle that could ensue. It would be unfair of me to comment on the pathways that come from primary care at the moment, because I don't do any in-hours anymore. I'm an urgent care GP. I can say what it's like to have health conditions where there is no pathway, because both of my health conditions didn't have a pathway, and they still don't have a pathway as far as I'm aware. And you are relying on clinicians with the experience and skill set to hold that and help you work out a way around that. And it's a very odd place to be in. It's very uncomfortable. And if you get someone that you don't know, you feel like you can't do anything with this, because they don't understand you, they don't understand your condition, and there isn't a pathway. So it's like it becomes a dead end, basically. And we are whole people. I mean, I think I've written about this in the book that, I had a lot of medications to help me. I had a lot of change in my diet, supervised by a gastroenterologist, but it did really help to get my head in order. I will be honest how much worry and stress I put myself under. And I think getting into a place of acceptance about the situation actually really helped calm my symptoms down. I mean, I saw two different GPs, and one of them did reflect back to me about how stressed I was, and I hadn't noticed it myself. We are whole people. We're not a brain and then a body, and I think that is maybe why patients are feeling more and more unheard, or one of them. I think there are many, but we need to see people, as whole people with lives.
Yeah.
It's a holistic thing.
Yeah. I think that comes across very clearly to me from the people I talk to online, is that sometimes it's the frustration in the system that escalates the stress, and then it's hard to remember what came first, the symptom or the stress, but they know full well that one's not helping the other, but they're caught into this spiral. I've quoted Ruby Wax many times to patients. I loved her book. She's if anybody's not aware with Ruby Wax, she's a very well-known comedian, but she is now learning mindfulness has transformed her mental health history because she's suffered with severe depression for most of her adult life and required inpatient treatment on a number of occasions. And mindfulness has given her a sense of control. But she summed it up in one simple sentence that ultimately the mind is the control center. And if that control center goes down, everything goes down. And I love that because I think that illustrates the connection beautifully in that you can't have somebody in peak physical condition where their mind is in turmoil, or vice versa. The two have to go together. And again, does our healthcare system really do justice to the impact that stress has on people's symptoms? Well, we're very good at focusing on the fast heart rate when somebody comes into an urgent care setting or A&E, or the fast respiratory rate. We're quite happy to acknowledge it then, but that low level stress that ticks along when somebody's not got a diagnosis, when they're being moved around the system, has to be having an impact to some extent. But to go in and raise that without a degree of trust, I suspect that is delicate territory, I would imagine. I would need to feel that I had the patient's trust to be able to start to introduce that as perhaps a contributing factor.
I think if you go in with that about it being stress related straight away, people risk, receiving that as this is all in your head, and you've instantly lost any trust that was forming or rapport. I think if you do your whole consultation and it seems to have gone well and you're in agreement at the end, I might bring it up. So have you considered, what else is going on? Usually patients will start to feed it in, like mention stuff's going on at work. And if you don't pick up on it, they'll mention it again. It's like there's a bit that's coming through, even if they haven't heard it themselves. It's something I notice a lot as a coach. I'd say, have you noticed you keep mentioning this? Have you noticed this? What does it bring up for you? And so, I didn't notice I was saying this. So, let's explore that further. But we have the time. One of the challenges about being heard at the moment for patients is the amount of time pressure, the health services, and so patients' information needs have changed. They want more information. There's information everywhere, isn't there? Some of it's good, some of it's bad. So they want more information from their doctor, which is fair. Like, why wouldn't they want more information? Yet the time we have is the same.
Yeah, I agree. Actually, just this morning, I did an appraisal on a brand new GP, and it was interesting to note her reflections on keeping to time. And I asked her to consider whether she's already assumed that keeping to time equates with doing a good job. And the reason she was reflecting on this was that a parent brought their child in and commented that that was 7.5 minutes. And that really her reflection from this was, well, perhaps I need to make it more clear that it's only one problem per appointment. And I just was, okay, let's just zoom out here. Keeping to time might make you feel on the one hand that you're doing a good job, but what is to do a good job? Actually, 7.5 minutes for a child with abdominal pain who might look very well might seem straightforward, but they're here for a reason. And I think that is a really complicated scenario really to take forward, and so anyway, hopefully she's got some things to reflect on from what we discussed today. But early on, we are under pressure to keep time, to keep hold of the appointment. And I'm not justifying this for cutting people off, but what people need in order to feel heard, 9 times out of 10 in my experience, is time. It is time more than anything.
Yeah. And I think one of my message to people listening is actually your GP wishes they had more time. They don't create these small time slots to be me. It's how much, how limited time is available for the demand, for the number of GPs that we have available. But most GPs would love to have more time with patients. I feel so sad hearing that it's, you get your child to an appointment, and for me it's quite hard to get my child over to the doctor's surgery, and then you get there, you've done it all, they've got their shoes on and all of those things, and then you can only do one thing with the with this child and book again. I think it's not a reflection on any individual. It's a pressure we're seeing across the NHS. You know, it's a political issue, a huge political issue, that we would like more time and continuity with our patients. And the top-down pressures are to just increase, you know, more and more access and hit targets. And that's not what good medicine is.
I agree. I think
having said that, I would say as a coach, if you really focus in or you're listening at a very deep level, you can help someone feel really heard and seen in a very short space of time. If you're really with them, but you can't keep doing that with every single patient.
I had a patient who reminded me of something I'd said once. She'd come in about a particular problem. We were chatting afterwards, and she said, I always remember you saying to me, don't book an evening appointment to see me, because by then my concentration's gone. And I felt a bit panicked that she'd remembered that, but it's true. I can clearly remember that when we would do a morning surgery, an afternoon surgery, and then an evening surgery, which wouldn't be a huge number of patients, but I used to dread and think they're getting me physically, but they are not getting the me that they would have got at 10 o'clock in the morning, which is
100%. You know, you've reminded me of us seeing a GP in our practice who are actually very, very good. Their access is great. I can't fault them, but we saw one of the GPs once at 6:30 on a Friday. You just thought, I think we won't book that appointment. It looked exhausted.
Yeah, it is. There's, and I think, I suppose in some way I was trying to protect her. Maybe she was complicated. I can't remember the details, but somehow I was probably trying to give her a subtle warning that try and book in the morning if you can. But I think what would be really useful for people would be to suggest some ways that people can perhaps prioritize some of the time. I don't think we're in a situation where suddenly we're going to be able to offer people half-an-hour appointments. I don't think that's going to happen, much as we would like it to. And one of the points I made in the post online that I find helpful if people have done it, and sometimes I'll do it with them, is to, rather than listing symptoms, put them into a timeline, because it helps to understand, particularly if something's been going on for 6 months, 12 months, or a long time, or even longer, just giving me a flavour of where those points were. And that can be quite revealing in itself. I had a patient once who was desperate to be seen by the community mental health team. He felt he had bipolar disorder, and he wasn't, I hate to use this term, but he wasn't bad enough for them to accept him at that time. But he came in with this fantastic timeline of his life, with this big peaks and troughs of how he'd been over different points. And his wife was sitting next to him, nodding in agreement about how chaotic sometimes they'd been. And ever since then, I remember thinking, that's really useful way of just on one piece of paper, putting a big story into a visual picture. And I did recommend that in this particular post. And some people have pushed back and said, but isn't this what the notes are for in a GP record? Surely the notes are that timeline. And I said, yeah, in an ideal world, they would be. But the notes are only as good as the person who's keeping them and what they've heard in that consultation. And that takes us back to the problem of, if somebody isn't being heard or feeling heard, or the message isn't coming through, then the notes will tell a different story. So that's certainly my number one thing that I like people to be able to do. Is there anything that you found works with people if they've got a long history, or is there anything you did in your journey through the healthcare system that helped?
Well, first of all, to say I've never asked a patient about doing the visual timeline, but I love that idea. I do use it as a coach, but if I'm doing something like career change to help people reflect on where they're at, and there's some. So to answer your commenter, there's something visual. So some of us are auditory people, some of us are more visual. So having a diagram changes the way we think and approach something. So I love that idea. I have to say, my own journey, I tried to stick doggedly to the same doctors. I was lucky that some of my care was private, not all of it. But that did help. It wasn't just about it being private. It was about someone who could see me and could manage to hold the doctor part of me and the patient part of me that helped me, feel seen as a person. and could manage something that didn't have a pathway. So those are all really key ingredients for me. But what I would say to patients is if they're going in and they've got a lot of different things going on and they're having that conversation in the waiting room, to start to self-prioritize before they go and decide what are the key things that I need to address before I go in. And if you don't know, your doctor can help you prioritize it. So like if we've all had patients come in with a list and say, okay, well, let's look at what we can prioritize. If it all feels important, or I can help you with that, because there'll be something that stands out to both of us as doctors that said, look, this is something, you've got a breast lump, we really need to look at this today. You can self-coach. I sometimes see that what do you need to make this a useful conversation today? What is it you need today when you walk out the door? And it just gets people thinking. And it might be like, well, I have to have a sick note today because I've been off work a week, as well as the other thing. That's the thing I absolutely must have. I can't rebook for that in a month. And then what's next? So start to look at it yourself as what's important to me today about this consultation.
Yeah.
And if you can't do it, ask for help to do it.
Yeah. Yeah, I've done that as well. When somebody's handed me a list that's looked very long and definitely not achievable in one session, then I've said, shall we have a look, and which ones do you want us to cover today and which ones can we come back to? I just thought of a point there. Somebody had said to me again in a comment on another post on Instagram just this week about how the doctor she was seeing, I got the impression perhaps the consultation wasn't going that well, but the doctor had said, what do you think's wrong? And her feeling from that was, how am I supposed to know? You're the doctor, is what her response was. And I said, actually, depending on how that's delivered, that can be a really helpful starting point, because in my experience, there's often a top one or two things that somebody's worried about. And if we can put that on the table early on, we can work to address that, rather than somebody being nervous about, well, actually, yes, I've got this mark on my skin, and what I'm really worried about is it's cancer, but I'm too scared to say that, or I don't want to tell you your job. Actually, I would say to people, get that out in the open early on. We won't feel like you're telling us our job. It's helpful to know that that's your primary concern, and we can rule things in or out depending on what your theory is.
I mean, a consultation is incomplete unless you've addressed the patient's underlying concern that this is cancer or whatever they think it is. Because if they put their symptoms into Google now, it tells them they've got cancer. Whatever their symptoms are, it just comes up as a differential. That question, I think, what do you think it is? Yeah, it sometimes doesn't land very well. I've seen it so many times online. So the doctor asked me what I thought, and, they didn't like that. And I said, well, I wouldn't be a very good doctor if I didn't take your views into account and address them. And then that usually makes them understand why I'm asking the question. Or you might say, what's the important concern that's underlying this? Are there any conditions that you're worried about that we think we need to rule out? So we call it the ICE, or ideas, concerns and expectations in general practice. So that's what that question is about for patients. Yeah.
What are your thoughts, Claire, on asking for a second opinion? Because certainly in the book, there are no shortage of doctors that, when they've not felt heard or appropriately taken seriously, have gone and asked for a second opinion. And I suspect perhaps that is easier as a medical professional, or a health professional, should I say, to perhaps recognise, I suppose as a doctor, there's certain things I'm hoping I might get out of an appointment, and maybe they've not ticked the boxes and I feel more entitled to get a second opinion. But if you're not from that background, you may not necessarily know that it's appropriate. Or I just wonder what your thoughts are on asking for a second opinion, even if it's from the same practice, from a different GP.
Go for it. Yeah, why not? I think it used to be the right in the NHS that patients could ask for a second opinion. I don't know where I read that or if it's true, but I used to say if patients would ask, I said, Just, what's the reason? Can I help answer the question, or what questions are you looking to be asked, or what's gone wrong? I certainly had second opinions on my journey. I mean, it was made very easy for we had at the time private health insurance through my husband, so I got a second opinion on one of the health conditions, and then I chose who I wanted to see privately about the other. So I had two diagnoses. So there was a doctor with a dual diagnosis, both of which were totally vague. So it was like a walking disaster, basically. But yeah, I think if people want a second opinion, I think that's totally okay. And sometimes it's much easier to get one in the same GP practice. Just as a starter, or go back and ask, one of the GPs that you know and trust, what they think.
Yeah, somebody commented that if you asked for a second opinion, you were likely to be removed from the list, and I was very quick to say that absolutely not. It's in fact there are very strict rules about when you can take somebody off a practice register, and asking for a second opinion is clearly not one of the criteria that enables you to do that. And I think I think being upfront when you're seeing if somebody comes to see me and say I'm not very happy with how it went with the last person or a specialist, it takes more time. If it's hospital specialist, of course, it sometimes might need a whole new referral, but from a GP point of view, I think it can have real value. I think what's the saying? I seem to have remembered it today, praising that GP, that new GPs will miss things through inexperience, and more experienced GPs will miss things because they think they've known it all. So sometimes there are advantages to both ends of the experience continuum, perhaps.
Absolutely. Yeah, I agree with that. I think that reflects my experience, that things happen at the beginning and late career, and there's a bit in the middle where you're less sure and most competent, so you're more vigilant. But yeah, I think second opinions are just part of medical life. I see quite a few, people have got complex cancers diagnosed. They want a second opinion from another specialist when they're facing something enormous. Yeah, it feels natural thing to do if you're unsure.
Yeah. I think obviously things are changing from a tech point of view as well. There is new technology now to record the consultation notes in real time. Some GP practices have adopted this technology, so you have to read over it and double check it, but there is software that will record the consultation, which I personally think is great for patients. And I would love to work in a practice that's using it, because I'd much prefer to not be trying to type things up as somebody's talking. But the fact as well that people can see their consultation notes, I think, has hopefully improved things for the better. I did have one patient who let me know that, just according to my records, I've had a knee replacement. I think we need to look at this, because I've definitely not, and somebody's letter had gone in. So I think people being able to see what's written is a positive, and gives an opportunity to correct inaccuracies if people see that there's something in there. But that's relatively new, isn't it? I mean, this has really only been in the last 3 or 4 years that people have been able to see stuff.
Yeah, just to pick up on the point about note scribes, I haven't adopted them because I felt like, they've got a formula and it was missing nuance and seeing the whole person for me. I still like to type my own notes, because at the moment it seems to capture more like what's this about for this person, what their concerns are, what's the context. Where I'm getting, with the AI, I'm getting bullet lists of symptoms, which just felt, I know with clinicians, it felt too clinical for me. I'm sure it'll evolve. But yeah, notes. I mean, some of the private providers, like the digital platforms, automatically do a video and patients got them. I think if it's done with mutual consent, it's good. I've had people come in aggressively waving a video camera at me, and that's not a good start for a consultation. But I don't think we should be, in general, afraid of this, for patients having recordings. Some oncologists record their first consultations when they're outlining very, very complex treatments. So patients can go back and look at it. You can create a transcription. There are exceptions to that, of course, when someone's experiencing domestic violence, safeguarding issues, and you have to be very, very careful about who can access the records for that person's safety.
Yeah. But I guess if there's, again, I can't speak for all doctors, but I would, if a patient themselves wanted to record our consultation, I can't imagine it would bother me, but I can't speak for all doctors, and some people might feel slightly defensive from the outset, perhaps, if that was introduced early on. But I think we'll see more of it.
But don't all surgeries record the incoming calls now? It's probably recorded somewhere on the system, and we record all our calls in out hours, and we are all telephone triage before we bring people in, and we've been doing it for years. And there was reticence at first. To be quite honest, it turns out to protect the doctor more often than not.
Yeah.
But this was covered, and if there's someone's been aggressive, the record of it, we just record them all as long as patients are happy. Sometimes people don't want it recorded, and it's okay, we'll turn it off.
Yeah, I agree.
It's just routine.
So just as a kind of closing topic, really more broadly on losing confidence, because this seems to be a particular theme. You're not feeling well, there's a dent in your confidence, you're not getting anywhere in the healthcare system, there's another chip in it as well. And in your experience, and probably I imagine you do more of this with coaching because it lends itself to coaching, you have more time, you have more rapport. What are the steps that you would work through with somebody who finds themselves in that kind of position?
I think first is exploring it more as to what's coming up for the person around their confidence, because people are individuals, and it may be that they are not at work, and work is a big part of their identity. It may be something about what they're able to do with their kids. And that's, if they're not able to run around with their kids, people are carrying a lot of guilt around that. It may be bringing up the fact that, they were not very confident in the first place, and now it's just plummeting. It may be about, giving themselves a hard time about how they're advocating for themselves in the health system. So there's all sorts of different threads we can give to ourselves. It may be, that they've given themselves a sort of negative label about being ill. So self-awareness is half of it. So most of us live such busy lives, we do not sit and go down into actually what's this bringing up for me right now? What am I thinking? What am I feeling? What do I notice about myself as I talk about this? So I would explore it at that level without getting too coachy on you. I use a model where we try and identify, the bit of you that's your best, your wisest, strongest self that you can really trust. I call it your inner leader. We look at what your values are, which are the blueprint of what you are. And that gives you a base, of identity that's separate to your job and what you do in your day-to-day life. And I might do some strengths finding with people as well. People can do their own strengths finding on, if you look at Gallup, GALLUP.com, it's £25 to do a strengths finding, which takes 30 minutes.
Okay.
And then we're going to look at where you want to get to and how you want to feel at the end of this. And then it really depends on the person, but we can do a lot of examining the negative thinking and reframing that, looking at more positive ways for people to think about themselves. One thing I like to get people to do at the end of the day is sit down and name 5 things that they appreciate about themselves for that day. It's not so much about what you did, it's about who you are being, like your personal qualities, the blueprint of who you are. So, say I was patient with my dog when he was barking, or I was I was playful and funny with my child, or I was able to be the organizer in this situation. Do you see what I mean? It's not about what you're doing, it's who you are being as well.
Yeah.
Because often the things that we do are somewhat removed from us, if we will. So it's about developing your sense of yourself in a different way.
Yeah.
It's not very British, right?
No.
To say I did this well. It's self-deprecating. I just said silly me, and I fell over, and really, even so, I was very resilient when I stood back up again. I was strong. So that kind of conversation I have with people.
I could imagine that somebody trying to do that without a coach is nigh on impossible, especially. I'm even just thinking about my range of friends in that, like you say, that is not something we do easily in our culture. We don't celebrate our strengths very easily. But there is real value to actually just putting some time in, whether it's per week or per month or whatever. And I'm a big fan of the Steve Peters chimp model, and he recommends that every day you should put in a little bit of reflection time. If you want to look after your psychological well-being, you need to treat it like your physical health and do that little bit of exercise as to how do you want to feel? Okay, well, am I behaving in a way that is likely to help me to feel like that?
So I'm curious, what's so difficult about this?
I'm thinking about the people that I work with, and it gets crowded out. I think there's two things, is that women in particular are very busy giving a lot of themselves to other people at work, at home, among friends and family. And they put themselves not necessarily last, but fairly low to the bottom. So if I'm trying to work with people to get them to make time to go for a walk or lift a few weights or actually do a bit of meal prep, stuff that I hate the term self-care, but it is self-care, and I can't find a better term for it, then it can so easily be displaced by other people's needs. And that's the practical stuff, because you have to eat. And I hope you feel you have to go for a walk. Yeah. So to do it for things that are much harder to pin down and probably need that help of a coach or a mentor to almost put the pressure on you to pin these things down, I think that's tough. Valuable, but tough.
Yeah. So it's about permission. My take on that is, if when you change your internal world like this, you show up differently and you show up better. You're more present with people. You can be, increase your personal power. You can be grounded. You could be wiser, and you increase people increase their courage. They increase what I call their range as a person. So if we're doing that as, someone who's having difficulty being a patient, we can work on increasing their confidence and courage to have conversations in healthcare, as well as, as well as looking at things like self-care. I mean, I hate these words self-care and wellness to talk about happiness and fulfillment.
Yeah.
Living the, expanding the range of a person so they can live the best version of their life available to them, and face their problems in the most effective way.
Yeah.
I think of it sort of stretching a person into a bigger shape.
Yeah. Funny that you just reminded me, I caught a thing on Radio 4 when I was coming home the other night, and they were talking about, I think the title was How Introverts Can Be Successful in the Corporate Space. I only caught a section of it, but this lady works with women in business, and she says before they're going on stage or doing any kind of a speaking event, she gets them to practice, she called them big power moves, so to get them to physically stand in a way that they take up more space. And she said it can
is that Amy Cuddy?
It might have been, because as I say, I was just driving a short distance and I wished I'd caught all of it, but I thought that's fantastic. Yes, take up space, and she said the difference it makes to people when they then go out and need to hold an audience is phenomenal. But if that's her name, I'm going to look her up, because she definitely was interesting to listen to.
For listeners, it's Amy Cuddy, Cuddy,
right.
And it's a 20-minute TEDx. It's had some controversy around it in research. So you've got this pose to do for 2 minutes to give you confidence before you go into a meeting or whatever. And her power pose has been found to not have any research behind it. However, if you slump forward and you kind of collapse physically, it does make a difference. You're less likely to be confident. So I don't know what's true. Unless you've got broken arms, I don't think you can do any harm to yourself when you study power pose. It's something I do sometimes. So I didn't do it before this podcast, but I might have done if I wasn't having a great day. Or do some star jumps, shake it out your body.
Yeah. I think there's real value to that. Who was I listening to talking about how, for some reason, they mentioned that theatre directors tend to have a really good eye for how people portray their mood and their mental state through their posture. And it hadn't occurred to me, even though I go to the theatre a fair bit, but I thought, actually, perhaps people in the arts world are more tuned into this sometimes than we are as doctors when we've got a revolving door of people coming in and out.
Yeah. It's something in coaching, you notice, what's going on in people's faces, or they say, people go, yes, I'm going to do it, like that.
Yeah.
Have you just noticed just shaking your head while agreeing? What's that about?
Yeah, that's good. A good observation, actually, I can imagine. Yeah.
It's fun as well as, self-examination and all of that kind of thing.
Yeah, I have to say, any friends of mine who've been through coaching can't rate it highly enough. You can see the difference in them, and when they've come out the other side. So I think if you're someone who is unlikely to buy the Chimp Paradox book, read it, go to the conference. I'm actually at one of their retreats this weekend. But if you're somebody who needs to work with somebody with something, then actually coaching is definitely something to look into, I think. And Claire, if you want to share how people can contact you, and then please do.
Sure. So you can drop me an email at hello@drclairedavies.co.uk. I have a website, drclairedavies.co.uk. It's in evolution at the moment, so there will be a lot more articles going on there in the next few weeks about confidence. It's written towards women doctors, but honestly, anyone can use them if they find it helpful. And if you have any thoughts or comments or want to talk about coaching, then I'm happy to receive an email.
Yeah, that's great to know. Great, Claire. Any closing points that you want people to take away from?
Be brave, people. Yeah. It's not easy. If you're listening as a patient and find it hard, I know it's tough, but you can find the confidence to do it with the right support. I'd just like to say thanks to Lynette for inviting me on.
Thanks for coming.
It's been a great conversation, and I've been looking at your Instagram. You're very, very clear on camera, and your message, your way of speaking, I'm sure really speaks to people. So it's been a pleasure to be part of this.
Oh, thank you. Thank you very much. Yeah, I seem to attract the right people who want to work with me. They're all a joy. So, so definitely it's landing with the right people. But thank you very much, Claire. I really appreciate your time. Thank you.